Welcome everyone. Thank you for joining us. I'm Fiona Reid, Manager of the Rural InReach program, and today I will be chatting with my colleagues Sarah Broadhead and Janet Pages-Oliver about stress and anxiety. So Janet, we all feel stressed at times. You know, I've even felt stress coming in here today. But what causes stress?
Well, Fiona, we all experience stress in our lives, definitely. Some of it's positive stress, but sometimes it's negative stress, and it's the negative stress that actually has the most impact on our bodies and how we're feeling about ourselves in our lives at that time. So some of the things that cause stress are financial pressures, relationship issues, managing kids and work and juggling everyday life. Certainly positive stress could be getting married or having a baby, getting a new job, moving to a retirement village, or whatever is going on for you in your life, things that you're actually looking forward to, even travelling. I'm travelling soon, so you know that has a positive stress effect on me. Yeah.
So it sounds like it can also be times of stress when we're experiencing a lot of change or important events in our lives, or those negative changes that have happened. But not, as you said, not all stress is bad for us. And I'm just wondering, Sarah, how does one know what is healthy stress versus what is unhealthy stress?
Yeah, and healthy stress is definitely a reality. Stress is a burst of energy, really, and it advises us on what to do. So in small doses, stress has a lot of advantages. It can help you meet your daily challenges, your daily goals. It helps you get to work on time. It helps you get the things done that you need to do in your day. So it's not always a bad thing, but it can become unhealthy when it starts to affect our everyday lives. So it can impact on our concentration levels. We can be getting headaches, we can be getting sick more often, we can have body aches, and we can become more angry and more anxious as well, and that's when we know it's becoming bad stress rather than good stress.
Great. And what happens to us, to our bodies when we're stressed, Janet? What are the physical things we might feel?
Yeah, well, our bodies have a definite response to stress. So basically, when something is really impacting on you in a negative way, or even with positive stress, the nervous system responds by releasing some what we call stress hormones, and they are made up of mainly adrenaline and cortisol. So I'm sure you've all felt that reaction when you've been driving along and something is coming toward you or something jumps at you. I regularly dodge kangaroos on my way to and from work, for example, and you get that immediate response of quick foot on the brake, take evasive action, and that's what the stress hormones set us up to do. So it's a fight or flight response that we carry out at those times.
And are there other key signs and symptoms of stress apart from that physical rush of those hormones?
Yeah, well, you know, your heart pounds faster, your muscles tighten, your blood pressure rises, your breath quickens, senses become a lot sharper. So, you know, for example, if you wanted to do something extreme, like an extreme physical sport like bungee jumping or parachuting, or, you know, jumping out of a plane, skydiving, then you would have the same response to that physically as you would to something that was imminently dangerous, like the car accident or potential accident, for example. So basically it gets our body ready to fight or to flee from the threat or the perceived threat at that time.
Are there other symptoms, like does it affect our memory, how we how well we work, how we concentrate? And
yeah, definitely. So some things happen to us also when we're under a lot of stress. and it's basically continual. So we would look at that as chronic stress in that instance. So definitely our memory is affected. We may think we've done something and we actually haven't completed it or haven't even started it. We can't concentrate properly. Our judgment is off, so our judgment isn't as good or as sharp as it normally would be.
We're not able to think through things perhaps as clearly as we would if we weren't under stress.
Sure. We're often also, we often tend to be very focused on the negative aspects of things rather than getting a more balanced perspective on life. We can have racing thoughts as well. So basically our minds are all over the shop. You know, it's very difficult to be focused and remain present. We worry a lot about little things that perhaps normally wouldn't bother us. We can become moody, so very sort of emotionally what we call labile, so okay 1 minute but really upset or distressed the next minute. Yeah. Can also become very irritable or short-tempered, can't relax, so sort of agitated. You know, someone who you see pacing around a room, for example, is often feeling very agitated and very stressed because of what's going on for them at the time.
You know, I'm also thinking, Janet, as you're talking about this, that fight and that flight response, but sometimes if there's been situations where I perhaps felt threatened by another person, I actually find that rush means that I can't respond at all. Can you explain some of that a little bit?
Yeah.
Why that inability to
respond? Because we all react to stress in different ways, and some of us will be, you know, will react immediately toward that perceived threat. Others of us just close down and we freeze and we can't do anything around that. Yeah.
Which is quite a scary place to be.
Definitely.
And I know, Sarah, you're going to talk a little bit more later on around some of the things that we can do to prevent or reduce our stress. But Janet, just from your experience and understanding, what can we do to help manage stresses in our life, particularly those normal stresses, those things that aren't necessarily unhealthy or threatening to us?
Well, it really depends on how we react to stress. Basically, how you react will then determine how best you will manage your stress and ways around doing that. So, for example, if you become angry or agitated or, you know, hyped up, for example, with your elevated adrenaline and cortisol levels from your stress, the best thing for you is to try relaxation techniques that slow you down. So meditation is really good, deep breathing, a guided imagery exercise that someone could do for you, or you could hear on a tape or DVD. That's really a great way to sort of calm you. If you become depressed or withdrawn or spaced out, then basically you need something to pick you up a bit. So rhythmic exercise, and I'll go into those a little bit later, around the best way to get that into your life. If you freeze, so we talked about that, basically, so that means you freeze internally, but you slow down externally. So you're racing inside, but you've slowed down externally totally. So basically, something like mindfulness, yoga, or walking meditation will bring you back to a more even keel. So
I'm thinking also about that, those grounding techniques of putting yourself back in your body, you know, reconnecting with, you know, there's a clock over there and I'm standing in this space, can also be really helpful.
Yeah, definitely. Yeah. But I think it's really important to understand you and how you react to your stress, so that then you can then choose the technique that works the best for you.
And also that stress is can be a really important indicator or guide for us, in that you know, it tells us when we're either in danger or we need to be more focused or responding in a certain way. So it's, again, I suppose that it's not always a negative thing. It can be a really positive, helpful response to a situation, and that listening to that and being aware of how we respond to stressful situations can help us better manage our lives.
That's right. But for example, you know, the positive stress I always see as helping me to get to work on time, to achieve deadlines when they need to be achieved. So it, as you say, it's not all bad, and certainly it's a factor in our lives, and it's just working out the best ways of working with it and managing it.
Yeah. So as we've been discussing, stress is a really normal response that can be really helpful in getting things done, meeting deadlines, brings a lot of alertness. However, it can also be not so helpful. But what about when that stress starts to become more than we can actually manage, and anxiety starts to manifest, and the potential or possibly even an anxiety disorder results? Can you tell us a little bit about what anxiety is, and in particular anxiety disorders?
Yeah, sure. So everybody experiences anxiety, and we might know it as being anxious, being uptight, nervous, worried or tense. And it can really vary in severity, so it can be from a mild uneasiness to up to a terrifying panic attack. It can be helpful, we've already talked about that, especially when we're avoiding danger, or to motivate us. And
Can feel a bit, sorry Sarah, it can feel a bit like nervous excitement as well.
Exactly, yeah, and a nervous energy, I suppose.
Yeah.
An anxiety disorder generally, it's more severe than normal anxiousness. It's longer lasting, and it interferes with your life, your work and your relationships as well. A few different types of anxiety disorders, and we probably won't go into these too much today because they can be quite complex, but there's things like generalised anxiety disorder, panic disorder and agoraphobia.
So agoraphobia, Janet?
That's a fear of open spaces. So people tend to become very reclusive, and can't even go outside their front door. So it's a very limiting and crippling condition.
And also it's that fear that when you're in an outside place that you will experience an anxiety or panic attack, which is similar to the sense of your heart really racing and that sense of a heart attack. So becoming very fearful of being outside in public spaces, and that you're hit by this really strong and overwhelming panic.
So there's also phobic disorders, so social phobia. There's post-traumatic stress disorder as well, which is quite a common one. We hear that term used quite a lot now. And also obsessive compulsive disorder as well, or OCD as it's commonly known as. So
if we go back to those phobias, what are some of the common ones that we think of?
Oh, well, there's spiders, fear of spiders. Yes. A lot of people are really frightened of spiders. That's arachnophobia. And then there's fear of snakes. I'm not fond of snakes. And lots and lots of them. So
fear of heights.
Heights, yeah, that's a good one.
Fear of closed spaces, like being in lifts.
Yeah, that's right. So being in, you know, small places, dark places.
Fear of social situations, having to speak to people.
Yeah.
Fear of public speaking.
And they can become quite severe though, can't they, in terms of even just seeing the image of a spider, even if the spider's not alive or real, can really create that anxiety.
That's right. And for people who are suffering from phobias of any sort, they find that it actually limits their life.
And post-traumatic stress disorder, Sarah said we hear about that quite a lot. What are the sort of causes, or how does someone perhaps end up really struggling with post-traumatic stress disorder?
Well, anyone who's experienced any trauma in their lives that hasn't been resolved, they haven't been managed to resolve it, it can come back in the form of post-traumatic stress disorder. And you would find people like refugees, for example, who've experienced terrible trauma in their lives. People who've been to war, so a lot of people
A lot of our veterans.
A lot of vets have that disorder. Anyone, like I had a minor car accident and a week later went to get into another vehicle to drive to work and couldn't because I revisited that experience. So those sorts of things, that was minor, but for people with post-traumatic stress disorder, it's acute and it's ongoing.
So it's that, again, it's a normal, what sort of causes it is a normal response in that when we're in that state of the hormones flooding our body, we're maybe not consciously or thinking about what's happening, we're reacting and needing to do what is required in that moment. And then usually at some time afterwards we get to process or have a think about that or make sense of it. And it's when that doesn't happen or the trauma is ongoing and is happening so much that our body is really flooded by the adrenaline and what was cortisol, that we're then unable to come back to a normal state of peace and calm.
That's right, yeah.
So particularly if children have experienced long periods of time or trauma, or the trauma's been quite severe, with that, you sort of stay in that fight or flight space for a good period.
You do. So you see some children who are in situations where they are in a heightened state of anxiety, if you like, because of those hormones in their body. They're incredibly difficult to manage and can be wrongly diagnosed with disorders when in reality it is a direct
response to stress. And the anxiety that's created.
Yeah. What also is interesting around those prolonged levels of cortisol and adrenaline in our bodies is that it can eventually have an effect on our brains and make us more vulnerable to long-term depression. Yeah.
So Sarah, as we've been discussing, anxiety and stress are quite closely related. The same hormones are involved and can have the same responses. How do we know that we're experiencing an anxiety response rather than a sort of that rather normal level of stress, and where it might start becoming more problematic?
Yeah, sure. So when you have anxiety, it's going to affect the way that you feel, behave, and your general well-being as well. So emotionally, it's an unrealistic fear. It's an anger, it can be confusion, it can be a feeling of being on the edge. Our thoughts are excessive worrying, our mind is racing, and we have a lot of problems solving day-to-day issues in our lives. The behaviour we might have is things like avoidant behaviour, obsessive compulsive behaviour, or an increased AOD use, so that's alcohol and other drugs. So just something really simple, like maybe you're noticing that you're having that extra glass of wine in the evening. Physically, I've got a pounding heart, we're sweating, we're quite often got a tingling sensation. So all those things come into having an anxiety disorder, and I already mentioned before, but generally it's more severe, it's more longer lasting, and it's going to interfere with our everyday life. That's how we know it's gone from being normal stress to being an anxiety disorder.
And I would imagine it's really important to see someone about that and talk through that is a diagnosable disorder rather than feelings of anxiety or feeling under stress.
We really encourage people to go see a doctor or go see anyone in the medical profession, whether it be a counsellor that can talk them through this. Don't go on Google. Don't go on Dr. Google.
So what suggestions do you have if someone is having a panic attack, which we talked about before, that moment of feeling quite stuck, but your heart is racing and perhaps you're having a heart attack? I know in the past I've had a panic attack and that I actually didn't realise I was stressed. It just felt like, oh, maybe I'm going to have a heart attack, which obviously I didn't.
Good.
That is good. So got some ideas around that?
I think it's really important to, if someone's having an anxiety attack or a panic attack and you can recognise that, you need to ground the person, maybe get them to sit down, get them to be aware of their surroundings, and to get their breathing a little bit under control. It used to be years ago that you would give them a paper bag to breathe into. Don't do that. That's now not the done thing anymore. It's more about just getting them to listen to how they're breathing. Quite often, just, you know, if you follow with them, so you breathe calmly and you get them to also breathe with you as well. Staying with them, not rushing off and leaving them by themselves, especially if your presence you think is making them feel much more comfortable. That's also important. Once the panic attack subsided a little, you can talk them through it. You can advise them to maybe get some professional help. If the panic attack isn't subsiding and it's getting worse, it's really important to maybe at that point call emergency services.
Yeah.
Basically, with that, the calmer you are, then the more impact that will have on the person who's suffering at that time.
I think it's also really important to remember that stress not only affects adults, it affects children as well. So Sarah, what else can we do to prevent or reduce our levels of stress and anxiety? Are there other preventative measures such as lifestyle changes that we can make to reduce those feelings?
Yeah, definitely. And the best thing to do is to avoid getting stressed or overly stressed anyway. So it's always better. Prevention is always better than dealing with the situation when it's happening. So you can do things like eat a well-balanced diet and eat regularly as well. This doesn't often get talked about, but every 3 hours is really important. Make sure you're not going for 4, 5, 6 hour periods without having anything to eat. It can send the body into a state of stress by doing that. Getting plenty of exercise and fresh air. So if you're working in an office all day, maybe going out at lunchtime and just having a 30-minute walk around in the fresh air, that can really help. Important to identify the current sources of stress in your life and what you can do to reduce or manage them. So you may have a particular relationship with a friend that's causing you to be more stressed, or it may be a task at work that's particularly awful or hard and you're wanting to get it out of the way. So identify those things and work through them. Make time for fun and relaxation. We don't do enough of that these days, so you've got to nurture yourself and make that time to have a little bit of fun. And as we've already mentioned, some relaxation techniques, and I think Janet will be going through one of these a little bit later on.
How important, Sarah, is physical exercise in terms of our mental health and particularly in terms of stress? There's been quite a few studies done.
Incredibly important. It releases a variety of hormones into our system. They're feel-good hormones, so they just make us feel better. We might have had a really terrible day, but you go out and you have a walk or a run and you notice that afterwards things just do feel slightly better. Also important for our circulation and just for our general health and well-being as well.
And sleep patterns, do they affect how stressed we are?
They do, they definitely do. So sleep is crucial for our body to function properly and affects lots of different things. It can cause a huge stress on our body, and that's our inability of our body to relieve the stresses during the day. So the purpose of sleep is to process what we've done during the day, and if we're not getting that enough sleep, we're not able to process all those things that have happened throughout our day, and our body gets more and more stressed. So sleep can also have a huge effect on our brain. Extreme sleep deprivation can cause things like hallucinations, and it can actually mimic paranoid schizophrenia if it gets to the point where we're barely sleeping at all. So really important to get enough sleep for a healthy brain. We've also touched on this before, but sleep affects our hormones, and our hormones, as we've already said, are very important when it comes to stress and anxiety. Your body regulates a lot of hormones during your sleep, so if you're not getting enough sleep, those hormones are not getting regulated properly, and this leads to unbalanced hormones. Also, if we're not getting enough sleep, we have chronic elevated levels of adrenaline. We've talked about adrenaline as well. Having too much adrenaline can sometimes not be a good thing. Although it can help us get through fight or flight situations, having always elevated levels can make us feel very anxious and very worked up all of the time. So the recommended is 8 to 9 hours of sleep a night. generally uninterrupted if you can manage it, and not having caffeine and alcohol before bed can really help with this.
Yeah. And is certain foods trigger or increase?
They trigger stress, definitely. So things like tea, coffee, and energy drinks, they have caffeine and they have theobromine in them as well, and they heighten our stress. Junk foods and takeaways, things that we know are bad for us. I'm talking about things like Chinese, Thai food, things that have been really highly processed. They don't have many vitamins and minerals in them, so best to avoid those because they can heighten our level of stress as well. Soft drinks, they've got a lot of carbon dioxide in them. That's what makes them fizzy, and this actual chemical can lead to us feeling more anxious and more stressed as well. And sugar, it pumps us up, it makes us feel like we're going quicker, and then all of a sudden it drops, and that's not good when we're trying to avoid feeling stressed. So what they recommend is having a rainbow diet, so lots of colourful fruit and vegetables, lots of whole grains, and lots of variety in our diet.
I think also just going back to that experience of a panic attack is probably really important in terms of managing that and helping someone else manage that, but that we should always seek professional advice if we've had that experience, particularly if it's a new experience, in case it is something that's actually a physical ailment.
Sure, because often if people have a panic attack, they actually can think that they are having a heart attack, but in reality they might be having a heart attack. So certainly it's something to have a doctor look at or get yourself checked out.
Absolutely.
Yeah.
Things like energy drinks and elevated caffeine levels can lead to you having heart palpitations. So, it can be an anxiety, or it could be something more serious.
What you've drunk, or it could be a physical response. So just seeking professional advice and making sure that you're healthy and that there's nothing else more concerning. So for each of you, what are your favourite de-stressors, Sarah?
I know mine's getting home, and if I've got the energy, put on my iPod really loud and go for a run. Even if it's just 20 minutes, doesn't have to be a very long time. Always feel better after that. In winter, I love having a bath. Fill up my bath with all the salts and the bubbles and just getting into it. That makes me feel much better as well.
I have to say, before Janet, you comment on some of your favourite strategies. One of mine is those meditative type activities. We often think of meditation as being still and sitting in a yogi pose, but it can be things like rock climbing, it can be sitting down by the beach and watching and counting the waves. So I really enjoy those types of activities, and I find those really distressing, just moments to be back centred and focused on that activity.
Yeah.
Yep.
I personally find anything that's more physical is good for me. I get such a lift when I work in my garden, for example, or go for a really strenuous walk. For me, that sort of covers it. I also like to retreat to my personal space, which is actually my bedroom. I feel safe, I can rest, I'm quiet. So depending on what's going on for me, that's what I like to do.
So Janet, you talked before about there's some really easy relaxation and techniques that we can use. Would you mind walking us through one of those at the moment?
Sure, be glad to. Okay, so I'm going to go through a relaxation exercise that involves breathing. I'd like to invite you all to join us in doing this while you're watching this presentation, although you will have your eyes closed. You can hear me, but you won't be able to see me. So Fiona and Sarah are both going to do this as I'm going through it. And then afterwards I'm going to ask them how it made them feel. So you'll get some on-the-spot feedback. Okay, so the first thing I want you to do is to make sure that you breathe really deeply from your abdomen. So try and get as much fresh air as you can into your lungs. When you take deep breaths from your abdomen rather than shallow breaths from your upper chest, you inhale more oxygen. So the more oxygen you get, the less tense, short of breath and anxious you will feel. So first of all, I want you to sit very comfortably with your back straight. Put one hand on your chest and the other on your stomach. I want you to breathe in through your nose. The hand on your stomach should rise, and the hand on your chest should move very little. I want you to exhale through your mouth, pushing out as much air as you can while contracting your abdominal muscles. That means squeezing them in, tightening them. The hand on your stomach should move in as you exhale, but your other hand should move very little. So your abdomen is doing all the work here. I want you to continue breathing in through your nose and out through your mouth. Try to inhale enough so that your lower abdomen rises and falls. Count slowly as you exhale. Okay. So Fiona, how was that for you?
It's really peaceful, really peaceful. I have to go back to work after this though, so.
And
it was
Sarah,
good.
how did that feel?
It was good. My mind just went blank for a few seconds.
Okay,
and just
great.
having that few seconds of blankness is, I think, important. Usually
Definitely.
there's so many things going through your mind.
Sure. Okay, great. Obviously you can do this for as much time as you have, or as little time as you have. It's designed to be used as a quick fix, if you like. It's not going to take away all your stress, but it's certainly going to calm you and quiet you and bring you back into a more balanced way of being.
Great. I think the other thing that I always find really useful and can be important is remembering that stress and anxiety do pass. It will pass.
Definitely.
I think that can be a really good self-talk when you're feeling stressed, that this will pass.
Sure. Yeah, it's important to remember that.
So if people are struggling or finding themselves overwhelmed by stress and anxiety, or are concerned about someone else in their life who may be having a really difficult time with stress, where can they get more information and support?
Well, from their GP, definitely. There's also, Sarah, you've got some information around.
Yeah, so there's places like Beyond Blue, Apple on Commit campaign. For young people, there's Headspace as well. Accessing your local government services.
They have 1-800 numbers for people in regional areas, that and sometimes those services are available in towns nearby, but they always have a 1-800 number. The one Beyond Blue particularly is a national service.
And it's also available online as well. They have lots of resources and lots of information, so certainly worth, if you've got the opportunity to have a look on the internet, check them out.
And also, if people are concerned around their own stress and anxiety or others, they can always contact the Rural InReach program on 1800 998 399 for support, information and or counselling. The other thing that we're really excited to be bringing here today is that the Rural InReach program is offering mental health first aid training for community members and professionals, which will be through video conferencing at the community resource centres. So if you're interested in finding out more about basic mental health first aid and having more understanding of that and how you might be able to help someone else, or have some ideas about managing your own stress levels, you can call us again on 1800 998 399 and ask to speak with Nicole Gale. So thank you all for being with us here today. It's been a really informative conversation, lots of really good strategies and concrete ideas on how to manage stress, how we impact stress in terms of our lifestyle and the things we do. Thank you to Janet and Sarah. It's been great being here with you today and having this conversation.
Thanks for having us.
Thanks, Fiona.
So goodbye from us today. We hope you enjoy the rest of your day and that it's very stress-free. Thank you.